Care Act is a piece of legislation that was introduced in April 2015. It basically replaces a lot of legislation that was very muddled and very messy, and it's essentially about how people who've got care and support needs can access the support they need. One of the problems with the earlier legislation was that people had to fall into a particular group, so you had to be seen as an older person, or a person with physical disabilities, or a person with a mental health problem to access care and support. And that left quite a few people then who kind of fell through the gaps. If you were homeless, you wouldn't qualify for support, but if you had a drug problem, you would have. So it was very, very complicated, and the main thing about the Care Act was just to make it much simpler. And really at the heart of the Care Act is that anybody who has got an appearance of need is entitled to an assessment.
Often people who are homeless have faced difficulty accessing the system. They weren't necessarily older people, they didn't necessarily have learning disabilities, they didn't necessarily have very obvious physical disabilities. But the new system under the Care Act focuses much more on the person's circumstances and the impact of those circumstances on their ability to maintain their well-being. In particular, it also covers areas of safeguarding, and self-neglect is explicitly included in the new criteria. What previously happened to lots of homeless people is that their behaviours were termed to be, or felt to be, lifestyle choices rather than a result of their living conditions. And as a result of that, they've often been overlooked. But because the Care Act now includes self-neglect as part of the criteria, then that's opened up much more access to people who are homeless in particular, and people who have multiple needs more generally.